Welcome back to calciumtherapy.com. Mark Manhart. I put this on a note here because I wanted to mention this. You know, things like calcium therapy, just like a lot of things, can be really complicated. The complex, you look at the details and oh boy, this is really. Well, what we found is calcium therapy is complex, but we can make it understandable. We don't have to use dental ease all the time. We can talk English and explain things to people and they understand. And it's amazing how many patients say, oh, holy cow, that makes sense. Why didn't I think of that? Well, that goes especially when somebody tells a patient in so many words, it's all in your head. Yeah, that pain, it's all in your head. You say that different ways. Take 2 aspirin and get a nap. Well, it is in your head. In dentistry, it's right here in your head, and we got to deal with it and help patients. This has happened in the last week where 2 cases came to us, one from Canada, one from Ohio. I had to tell these 2 patients separately. I had to say this. What we have learned from your case of dealing with something we call osteoendocystic therapy, the diastema problem that's right up here. Both of them, I said, your recovery, the fact that you and I found this problem and we solved it, is the most remarkable thing that's happened to me as a dentist in decades. And I would say this, it's because of you and because of what we did. I'm practicing 20 years after I should have retired, because seeing these and solving these problems makes my life wonderful, let alone the patient. That happened in a weekend on 2 separate patients, and if I start giving you the details and you are a dentist or hygienist, I can guarantee you will not believe it. And so that's fine. I'm not asking you to believe it. I'm saying, based on these 2 cases, tells us every person that goes into a dental office ought to be getting calcium therapy in some form. What did we discover on those patients? Each one had a tooth that was totally dead, and nobody for 20 years, 30 years, actually even looked to find it, actually even listened enough to investigate it. And one had to do with the face, I'm a dentist, of sight, I'm a dentist. We are part of medical science. Why was it all of that? Because the nerves that come to the mouth and the teeth comes from the trigeminal trunk, and it splits off into 3. And those 3 cover this whole area of your head. So yes, it's all in your head. And it's in the sinuses. Now I want to talk to you some about skin. Can you believe that? Thanks for coming.